I'm going to hand it over to Mike to go through these concluding 4 steps.
Great. Hi, good morning, everybody. Lovely to see you all on the call this morning. And again, thank you for hosting us in your beautiful island. Just so nice to wake up this morning to such an amazing view out of my hotel window. So yes, I'm going to briefly walk you through these 5 next steps and start by talking about how we provide home isolation instructions. Specifically, the details around the duration of isolation, what does isolation involve in terms of self-care and monitoring, and then what are the warning signs for somebody who is self-isolating at home when they should access or reach out for help. Next slide. So as we'll discuss this morning, another key component of the case investigation interview is to elicit the details about the contacts. And this is important, right? Because as we discussed earlier this week, we want to know who are the close contacts of any individual who's been confirmed to have COVID-19 so that we can reach out to them. That's the function of the contact tracer. And so key to doing that is establishing who those people are and where the cases come into contact with them. More often than not, the close contacts that people will identify and that will be elicited in the context of the case investigation interview are household contacts. But sometimes it's work colleagues, and so ask inquiring about who they are, ideally getting a name and some other piece of unique identification is useful. At the very least, so you really need to get a name and a phone number. And then because it helps to prioritize which contacts to reach out to first, we also ask the case, can you tell us whether that individual had any symptoms of COVID and how can we get hold of them? And again, in San Francisco, where the vast majority of cases and contacts speak Spanish, we also want to know right from the get-go what's the preferred language of the contact that we need to reach out to, so that we can match the contact tracer's language expertise with that language preference for the contact. Next slide. So I think one of the other things that's important to highlight is that oftentimes in the midst of making these phone calls and asking cases about who their contacts are, you will need to anticipate and respond to questions that may be raised. And the kinds of questions that individuals with COVID will probably raise when they're asked about their contacts are, do I have to tell you who I've been in contact with? Well, no, we can't force anybody to give us that information. But understanding the rationale for why we might want to reach out to them might help explain and persuade any given person why we do that. Will my friend or coworker be deported? So again, this is something that's important in California, where we have a large population of undocumented individuals, and absolutely we never reveal the documentation on the immigration status of any case or contact. What are you going to tell roommate, coworker, friend? So I think this is an important point to emphasize, but we don't routinely reveal the name of the index case, the individual who has COVID, to the contact. We just alert them to the fact that, hey, we've been informed that you've been in close proximity with somebody else who has COVID, and that's why we're reaching out to you. And this is important because sometimes the case doesn't want the contact to know who it is. Very often, though, if it's a household contact, they already know, right? It's hard to hide these things from your family members, but perhaps in a workplace environment where you don't want people to know, it's important to appreciate the value of confidentiality. Do people have to know who I was the one who had COVID-19? Again, it sort of speaks to the same concern. Wherever possible, we try and protect the anonymity of the case. As I say, sometimes that becomes challenging just based on individual situations. But wherever possible, we want to esteem the confidentiality of the case. Next slide. So in this context, the contact is told that they've been exposed to COVID-19, and we provide them with important messages about how the virus is spread, and we ask them about symptoms. And so these are the important things that you as the case investigator should know when you're reaching out to a case, so that you can explain to the case what's going to be asked of the contact. But essentially, every contact, we do three things. We inform them, hey, you've been a close contact of somebody with COVID-19. We educate them, what does it mean to be a contact, why we're worried about being a contact, or what's the concern. And then, as Doris alluded to, we resource them. We want to provide them with the wraparound services so that they can quarantine appropriately. And those are the three components of what contact tracing involves. So inform, educate, resource. Next slide. This slide is germane both to case investigation and to contact tracing, whether we're reaching out to a case or a contact, whether we're asking a case to isolate or a contact to quarantine, we're asking them to take on a responsibility. We're requiring them to stay at home more often than not, and not do their daily work, not leave the house, etc. And so as part of an assessment of whether any individual will be able to safely isolate or quarantine, it's important to determine, is there a place where they're going to be able to isolate or quarantine? Is there a room in the house where a case can isolate from the rest of the family? Do they have space to do that? In terms of basic necessities, is there somebody that could deliver food to the door for them for the duration of isolation? Do they have family members that could support them during this time by delivering food and other things? And if not, is there a way that Department of Public Health and or others could provide them with the resources to do that? Sometimes the case is somebody that has chronic medical conditions and they need continuous supportive help with activities of daily living. And so determining who can do that, who can provide those care needs during the period of isolation is critical. And that might be a reason for engaging social services to determine who can visit, and do those people have the necessary personal protective equipment to do that. And then, on a related note, are there other people in the house whose needs need to be attended to? If, for example, the case is the caregiver for somebody else, and they can't safely deliver care to another family member whilst they're isolating. These are all things that get captured in the case investigation, and the resources available to support those individuals will be determined by the resources available here in Guam, and the guidelines that are outlined by the Department of Public Health. So I can share what we do in San Francisco, but that might not be quite relevant. So I think the key message here is that as part of that case investigation interview, it's crucial to assess what the needs are of any given individual. And I think one thing here to sort of highlight is that those needs are maybe are very diverse. Some people have medical needs. On a rare occasion, somebody might have a substance abuse issue and they need support with that in order to isolate appropriately. Somebody else might need medications delivered because they take daily medications, or they need some dispensation to access dialysis if they're on end stage dialysis, and that has unique challenges that will require unique responses. And you're not expected to know what all those responses are, but I suspect there's somebody within the Department of Public Health who's already thought these things through and has guidance that can support you. As I say, the key message here is to anticipate and be able to respond to each individual's unique challenges so that they can be successful in isolating. All right. So just in terms of the other functions of the other components of the case interview, and I'll just wrap up and hand back to Laura on this slide. I think one of the things that I want to emphasize really clearly is whenever we get on the phone, either to a case or a contact, is to express gratitude. I do think helping people understand that their responsibility in this moment in terms of fulfilling the obligations of isolation or quarantine so that they can protect other vulnerable community members is critical. And as people understand that, I think there's a crucial value in just thanking them for their contribution in this way. And many people don't, they don't understand that to begin with. They feel terrible. Maybe they're suffering from COVID, but realizing that actually by staying at home, they're saving the lives of the elderly members of our community, those people with chronic medical conditions. So ending with a thanks is critical. Making sure that they have the information they need so that they can access help is also, essential. And then alerting them that, ideally we'll be reaching out to their contacts. The contact tracing team will be reaching out to their contacts as soon as possible. And then highlighting that our goal is to offer a client-centered approach, offering opportunity to answer any final questions, I think is critical, as well as giving people, a callback number. Those are sort of, just the basics of how we end the call. Laura, anything you want to add? Otherwise, I'll hand back to you.
Yeah, thanks, Mike, and everyone who's so engaged this morning. And just to add that, as Jim suggested, many places do have a system in place to send follow-up information. So that's another thing to conclude, because understanding, I know I've given you a lot of information. Don't worry, I will be sending all of this to you by email or mail, SMS, whatever system's in place is definitely a key helpful point. So we're going to go ahead and continue, just flashing this key slide that we also looked at yesterday with reviewing our definitions of a case and a close contact. I think we have those down. And then isolation that separates the infected people from others. This is for cases, they're already infected, so we want to isolate them so that they cannot infect anyone else. So we're going to get into the isolation time period. Quarantine separates individuals believed to be exposed who are not yet ill. So that is for the contacts. And the infectious period is the period of time when cases are considered to be potentially contagious. So this is related to our contact elicitation window that we're going to go ahead and jump into these basic calculations, focusing on the pieces of information that you want to get during your interview. So the contact elicitation window is the time frame when the case is infectious or contagious, able to spread the disease when not under isolation. So if someone is isolating, they're not able to spread COVID to anyone else. So we don't include that in the window. So within this window of time is when we will collect all close contacts exposed during the time period, remembering the definition of a close contact being within 6 feet for at least 15 minutes cumulatively, maybe 10 minutes or in the morning, 10 minutes in the evening. So what is this contact elicitation window? Different for those who are showing symptoms and those who are not. So let's start with someone who's showing symptoms of COVID-19. We want to consider 2 days prior to the start of symptoms. As we've seen, this is when there is a higher viral load, and even before we see symptoms, it's still possible for someone to pass COVID to someone who's in close contact with them. So 2 days prior to symptom onset is the start. So this is just a simple date of symptom onset minus 2 days. That's when we want to start getting the contacts, and we complete the window when the case goes into isolation, as we don't need to, they won't have contact with anyone then. So we just remember that minus 2. But what if someone has no symptoms? You know, they have been tested because they were a close contact. So we won't subtract the 2 days from, we don't have a symptom onset date. So we're going to use the date of positive test, not the date that they get their results, but the actual day that the test was taken. Okay, so we're going to go 2 days back as sort of a proxy for when they started to become infectious and start getting the list of contacts then, similarly ending on the first day of isolation. So within this window of time is when we want to ask the case to list all of the close contacts from that time period. So you'll want to walk them through, you know, any of the activities that they've done during that time period to try and get an idea of who they may have seen. So trying to keep it simple, let's just go through an example here of John. You have him on the phone, and he noted a mild cough on the afternoon of May 3rd. So your calendar is going to be a good tool when you're doing interviews. It's just good to have one on hand to help you kind of look at the dates. So we see here his date of symptom onset is the 3rd. Then he got tested on the 4th, received his results on the 5th, and started to self-isolate. When do you call him? You call him on May 6th, and you find out this information. So if his symptoms started on the 3rd with that cough, we count back 2 days, going from May 3rd back to May 1st. And so then he began self-isolation on the 5th. What is the window? All right, so we want to get the contact elicitation of the 1st through the 5th. So those green days and the blue days. Okay, so this is kind of where it's using some interview skills to do some recall, you know, of if that was over the weekend, you know, what do you remember that you did over the weekend? Did you, you know, do anything social? How did you start your day? What do you normally do on Fridays? So just trying to kind of walk through day by day to try and get that recall of everything, every opportunity that there may have been contacts. So let's do a practice case together. We can continue to practice in office hours and everything as needed. Let's look at Maya. Okay, so she had a mild sore throat and low-grade fever on and off starting Thursday, May 7th, and then began to cough on Sunday, May 10th. She went to work at a grocery store on Monday the 11th, but left to get tested later that day. So she got tested on the 11th. She went to the drugstore on the 12th, got her test results later that day on the 12th, and started to isolate later on the 12th. She lives with her boyfriend. He started sleeping on the couch. She disinfects the bathroom after each use. No one else comes over. So you speak to her one day later on the 13th. So just take a look here. I'm going to ask you a poll question. What is the window period for eliciting names of close contacts? So we want to think about those key pieces of information, the symptom onset date, and as the piece of information for the beginning, and then the start of isolation for the end. So just take a minute to Whoops, let me go back just to give you one more second before I ask you, what is the contact elicitation window for Maya? All right, so let's put up the poll here. Would the window be May 10th through 13th? Would it be the 7th through the 12th? Or would it be the 5th through the 12th? I will flash that situation up there one more time. Remembering her symptom onset was Thursday, May 7th, start of isolation on the 12th. All right, great work. Thanks for those who answered the poll. Okay, so great. It looks like 89% said C, May 5th through 12th. So that is the correct answer, that we saw symptoms started on the 7th. Those of you who selected B, don't forget that we want to take 2 days before the symptom onset date as the beginning of our contact elicitation window. And also, if there were no symptoms, we would have used the test date, but we always want to go those 2 days prior to symptom onset or test date. So that window begins on the 5th of May. And then it looks like everyone understood that when she began isolation on the 12th, the contact elicitation window finished. So just checking the chat here. Great, Jim had it right, but it's not 10 days starting on the 5th or the 15th. Jim, I think you're getting ahead to the isolation period where we talk about 10 days. So I'm just about to get into that. Contact elicitation window is not a set amount of time. It's really based on the beginning with 2 days prior to symptom onset or test date. It's really just that period that they are infectious and in contact with other people that we want to elicit the close contacts. So we can't give it a set date here. So here we are getting into that review of the end of the infectious period, end of isolation. So we have several circumstances, really 3 key points for noting the end of isolation. And so this is where it can seem complicated, but really the key point is to remember that it's generally that 10 days since symptoms first appeared. Okay, but we have to remember that cases need to go first and foremost 24 hours with no fever, including while using, no anti-fever medication, Tylenol, ibuprofen, etc., and improving symptoms. So there might be lingering cough, but that is okay so long as it is improving. If it's worsening, we would not want to end isolation. And then the 10 days since symptoms first appeared. Okay, and the exception is the limited number of those who had a very severe illness, and we might consider 20 days after onset. That is really limited number of cases. And then for those who don't have symptoms, it's really just straightforward with 10 days from the date of the first positive test. All right. And these are basically the CDC guidelines here. So see your question, Rita. This should be the guidelines for Guam. There was a period it switched in June or July of, it used to be 72 hours with no fever, but now that is the guidance.
Can I just say something?
Now, as you go through that contact elicitation window, you'll hear about different activities that people may have done in that infectious period. So this is really important to keep an eye out for any potential outbreak or high risk settings. You know, if someone informed you that, you know, during that infectious period, actually they were working at a senior care facility, or they, you know, were working in their child's classroom, or went to a really big party or event, then this is something that the health department would want to be aware of, to be able to, you know, people might not know all of the close contacts that were in those settings, but we want to make sure that that is alerted to the appropriate teams to break that transmission change by alerting everyone that was there.